Climate change and dengue transmission in Grenada, 2010 to 2020. Should we be concerned?
Our study key objective was to determine the relationship between dengue cases and rainfall patterns in Grenada over the period 2010 to 2020. It is already well known that dengue is a vector-borne disease transmitted primarily by the Aedes genus type mosquito. This disease is endemic to Grenada and many other Caribbean countries. Climate change effects can result in precipitation and temperature variability that is well suited for the reproduction and spread of this mosquito. To date, limited studies have been conducted to understand the relationship between the meteorological conditions and dengue prevalence in Grenada, hence the importance of studies like these.
In our methodology, analyses were used to determine whether there was a relationship between dengue prevalence and rainfall in Grenada for the period of 2010 to 2020. Data was provided by the Ministry of Health and the Meteorological Office in Grenada. For the correlation between rainfall and dengue cases, we saw that there was a weak but significant positive association between rainfall and dengue cases. Pearson's correlation R we have being equal to 0.115.
In our results, looking at rainfall and dengue cases, we plotted a histogram. And looking at the information, the graph, we see that lowest prevalence of dengue cases were presented in 2015 and 2016, with 7 cases and 76 cases respectively. An average rainfall in 2015 and 2016 was very low, lower than all other years, except in 2013 and 2020. In 2013, we see that rainfall amounted around 900 millimeters of rain, and in 2020, we see it close to similarly 897 millimeters of rainfall. The key note here is that we saw the highest prevalence of dengue being presented in 2020, around 550 cases, and closely followed by the 2018 case count of 405.
Grenada experienced the chikungunya outbreak in the 2014-2015 period, and that led to rigorous vector control measures to control the mosquitoes. Also, there was a COVID-19 lockdown in March to May of 2020, and that halted vector control measures, possibly contributing to the steep rise in cases, despite the lowest rainfall of all the years 2010 to 2020. For the seasons and dengue cases, here we have a table showing the total cases for the dry season and the total cases for the wet season for the period 2010 to 2020. The highest number of dengue cases were observed in the wet season, and that would be between June to December, epi weeks 23 to 53. High number of cases were observed in the dry season, in particular 2012, 2014, 2018, and 2019, with less than 50 cases reported in the dry season in all the other years. Trend of increased reported cases were observed following periods of prolonged rainfall for 1 to 2 weeks.
So, looking at the data, we can agree to see that there was no evidence of serious decline in cases in the wet seasons. There is also an apparent increase in cases in the dry season over the years. Vector control interventions we observed prior to prolonged rainfall can be an effective measure to control dengue cases in Grenada and also in other Caribbean countries. Need for coordination between vector control units and meteorological office is important to inform an evidence-based dengue warning system. The elimination of mosquito breeding sites should be ongoing throughout the year, including during the dry season and even during periods such as COVID lockdown periods and any other emergency situation. Thank you very much for your attention.